assessment of the eye, like we said, the first part will be to assess for visual acuity. So we ask the patient to stand, the first one will be for the distance vision. We ask the patient to stand 20 feet away from the Snellen's chart. Okay, so if they're wearing glasses, if they're wearing contacts, they're supposed to take it out. Of course, during the exam, they don't need to take off their contacts. This is not 20 feet. The 20 feet is actually the middle of the whiteboard, but because of the wall, it's going to be an obstruction, so we just presume, okay, we pretend, okay. So we assess one eye at a time. So please, Amy, can you cover one eye? Okay. Now, tell me the number, the smallest line that you can read clearly.
4.
Okay, can you please read the letters?
L-P-E-D.
Okay, can you read line 5?
No.
Okay, so she was able to read line 4 for the left eye. That's 20 over 50. Here is the thing. If, for example, you have your patient and they read, let's say, L-D-E-D. Okay, so they had one mistake. So if you were to record that or document it, you would put 20 over 50 minus 1, meaning they missed one letter. Okay, how many can they afford to miss? It depends on the number of letters. If Amy missed one letter here, I would say, maybe you're not seeing it very clearly. I would ask her to read the line above it, the letters above this line 4. Now, if, for example, you go lower, like in line 7, there are 7 letters. If they miss, let's say, 3 letters, and I go, oh, maybe it's not very clear, because you're now like guessing. Okay, so it would depend on the number of letters per line. Now, with Amy, she was able to read the line 4, no mistakes. So you ask her, can you read line 5, the smaller line, the line next under? But she says, no, I cannot. Okay, but if she can, then ask them to read it, and if they're still able to get it, go down a line. Okay, so for her left eye, it would be a 20 over 40, meaning 20 feet away, she can read line 5, while those with normal eyes can read line 5, or line 4, sorry, we were at 20 over 50, so she can read at 20 feet, there's 4 letters, but comparing it to people with normal eyes who can read line 4 50 feet away. Okay, now let's do the other eye, please. So the number with the smallest line you can read?
Same line.
Okay, can you read the letters, please?
L-P-E-D.
Okay, so for the right eye, it's also a 20 over 50. Can you read line 5?
No.
Okay. Now, when you're assessing your patient for the distance vision, make sure that they're not squinting, they're not, looking, pressing forward. They have to be very relaxed when they're looking at it. Okay? All good? All right. Next, we move on to... Can I have a seat? I need a seat for my patient also. Go ahead. Okay. So we now assess for near vision. So again, we assess one eye at a time. Glasses off. Okay. Now you will note, if you remember the Jaeger chart, okay, the side that has the bigger font, you show it to them. If they can read the top box, then that's the time you flip it and ask them which box number can they read, the smallest box number they can read. Just ask them to read the first line. Okay, 14 inches away. Cover one eye, please. Okay. Can you read number 7?
Yes.
Okay. So which number, box number, can you read clearly?
1.
Okay, can you read the first line, please?
In the 2nd century of the Christian era, the Empire of Rome comprehended the Ferris.
Okay, thank you. So this number 1 is counterpart of the 2020 in a Snellen chart. Okay, so we just say 14 over 14. Okay, for, which eye was that? The left eye. Okay, now let's cover the right eye. Okay, again, show them this side.
Yes.
Can you read? Okay, which box number can you read
1.
clearly? Can you read the last line, please?
Peaceful Students enjoyed and abused the advantages of wealth. Those are some really hard words.
Okay, so just ask them to read, instead of the whole paragraph, just a line. Okay, so this is for Jaeger chart. Like I said, if she were moving it farther away, then that means she has myopia. But sometimes you will also see patients, even this one, they cannot read. That means they really have very poor vision, okay, that they need to bring it closer to be able to read it.
Thank you.
Okay, oh my gosh, tell me you got what Kit has.
I'm not sneezing, I'm coughing.
That's the start. Okay. So this is for near vision. All right, questions? Next, we move on to,
Oh my gosh.
Do I lost it?
okay, so this time we move on to peripheral vision or confrontation test. So we said we position ourselves 2 to 3 feet away from the patient. Okay?
Yeah.
All right. Okay, so this time we now ask the patient to cover one eye. And if the patient covers the right, you cover your left. So it's going to be opposite. Look at this. Okay? So, Amy, just look straight ahead. Okay, when you see my finger come into your field of vision, say now. All right? Okay, so,
No.
okay, so this is the superior field. And this would be, what is the angle? 50. Okay. Temporal.
90
Okay, 90.
No.
Nasal, 60.
No.
Inferior,
70.
70. Okay, now let's test the other eye. Okay, again, just look straight ahead. Look at me.
No.
Okay, superior,
50.
50.
50.
No.
90.
90 for temporal,
60.
nasal for 60,
No.
70.
70 for inferior. Okay, so like we said, they should be able to see the fingers. Now, when you're doing this, please stretch out your fingers. Do not go, can you see this one? This one. Of course, they'll be able to see it, so stretch it. Okay, so that's important. Well, that's as long as you stretch. But even if you have long fingers, but you do, can you see this one? Okay, so
90.
90, no, 50,
That's 50.
90, 60,
70.
70. Okay, so those are the visual
90,
angles.
60, 70.
Okay. Next, we now go to the extraocular muscle function tests. So the first one will be the corneal light reflex. Okay, so here you have to come closer. Okay, I will shine the light on the bridge of the nose. Okay, see the pinpoint reflection of light? Okay, you see it? You don't see it right now. There, do you see? Mm. See the reflection?
Do I see it more on the left? Same location.
Same location.
Oh, yeah.
You see it?
Yeah.
All right. So that is for the corneal light reflex. We observe for the pinpoint reflection of light, they should fall on the same spot in both eyes. Okay. Now we test the cover-uncover test. Next time. Okay. Let me just look at me. Okay. I will cover one eye. Right. Observe the eye that will remain uncovered. Okay. All good? No movement, right? Any movement?
No. No movement.
No. Now check the this eye that I will uncover.
No movement.
No movement. So that is the normal finding. Anyone here with a lazy eye?
Can I try?
Not that I know.
Okay. So again, this time, look at me. Look at this eye that remains uncovered. No movement.
No movement. No movement.
So that is the cover-uncover test. So we observe for the movement of the eyeball when you leave it uncovered and when you uncover the eye. Okay. Next, we do the extraocular muscle movement or the 6 cardinal fields of gaze. So Amy, please follow this pen light. Okay, do not move the head, just follow it with your eyes. So from the midline all the time, look at the eyes. Okay, so you see the very smooth movement of the eyes. Now, I said sometimes you can elicit nystagmus. So nystagmus is the jerky movement. Okay, so look at her eyes as she tries to follow this pen light. See the jerky movement?
Don't do that to me.
I wanted them to see it. Did you see it?
Yeah.
Okay. So that will be the nystagmus. That's why I said you do not stretch it all the way. Do not bring it all the way up. Okay. All good? Okay. So that's the 6 cardinal fields of gaze. Cranial nerves.
3, 4, and 6.
3, 4, and 6. Good. All right. Now we do our assessment of the external eye structures. So we start with the eyelids and eyelashes. Okay. You cue me. Okay. So for the eyelids and the eyelashes, so just look at the eyelid margin. Okay, so you'll see it's pinkish. Okay, and you'll see that the hair, the lashes, they're spread evenly along the margin. Now please look down. Okay, same is true with the upper lid margin. And now this time the lashes, they're curled upward and outward. Okay, let's check the other eye. Okay, so similarly. Okay. Now, the blink reflex, you have noticed, she does not need to, you don't need to, let me count the blink reflex. Okay. So, because you'll be able to observe that as you were doing the other assessment. So, between 15 to 18 blinks per minute. Now, we do the conjunctiva. So, this time, this is our, okay, please look up. Palpebral, the pinkish. Okay, can you see? Okay, and now to assess the bulbar, you can see it better here. See the transparent layer covering the eyeball. Okay, that's the bulbar conjunctiva. Okay, so you need to ask your patient look down if you're pulling up the upper lid margin, and then look up if you're pulling down the lower lid margin. Okay, so similarly on the, so look up, palpebral, and then look down. There is your bulbar conjunctiva. Okay, now we assess the sclera. So the sclera is this whitish portion of the eye. You will see the bluish white. You will see there are some small blood vessels. Okay, and that is normal. It's a conjunctival injection. When you say injection, that means it's like the vessels are very, very prominent. Okay, then we assess cornea. To assess the cornea, you have to stand at the side, shine the light at the side of the eye. Okay. Amy, I'll pull up the. See the dome-shaped structure, transparent? Can you see it? Come closer so you can see.
That's the cornea.
Dome-shaped, transparent portion of the eye. See it? It's clear, right?
Yeah.
Okay. Now. All good? Okay. Now, I will, you look for the lens so that, we don't need to do this. I won't need to stand in this area again. Look at the lens. So it's going to be behind the pupil and the iris. Okay. So again, transparent. Can you see it? Now you have to come to this side because it's going to be hard looking at it from there. You see it? The lens is behind. It's again a transparent layer. Okay, behind the iris and pupil. Okay? All right. So that will be our cornea, transparent and clear. Okay, same is true with the lens. Okay? You don't see any opacities. Of course, when you have opacities in the lens, that would mean there's cataract. No arcus senilis. Okay? And then we observe now
Iris.
the iris. Okay. So we said the iris is the colored portion of the eye. Okay. You will note that the color is grayish green, grayish blue. Okay. And the color of the eye of the right is the same as that of the left. The size of the iris is also the same. Right?
Mhm.
Okay. Now we assess the pupil.
I have a question. What
Pupillary
about that
reaction
brown
to
dot
light.
in there? What is that?
Oh, that's a pigment. It's a normal finding. Mhm.
Pupillary.
Pupillary
reaction
reaction.
to light.
Yeah, there's even here
Direct
there
is
is.
first
Ah,
one.
there is
Okay.
it. Oh, yeah.
So let's do the pupillary reaction. So I will shine the light on the what they call this, on the right.
Oh.
Okay. From here. Always start from the side. See the pupillary reaction,
Mhm.
the constriction.
So it's reactive.
Okay. So that is direct. Okay. I shine the light on this eye. Look for the constriction of this pupil. Now I will do indirect. So shine the light here. Look for the constriction on that other pupil.
Mhm.
Okay.